Welcome to the Expert Roundtable podcast, where we connect frontline clinicians with top thought leaders to facilitate discussion on key issues they face daily.
Today's podcast will focus on chronic lymphocytic leukemia with Dr. Ian Flynn from One Oncology and Tennessee Oncology. Dr. Flynn, would you like to introduce yourself?
Yeah, hi everyone. Ian Flynn from One Oncology and Tennessee Oncology. I'm a clinical investigator and clinical researcher in the area of chronic lymphocytic leukemia and lymphoma.
Thank you. And Dr. Parikh, would you like to introduce yourself?
Yeah, hi. Thanks, Dr. Wine, and hi, everyone. Thank you for having me. My name is Samir Parikh. I'm a hematologist at Mayo Clinic in Rochester, Minnesota, and I focus on CLL as my clinical and research interest, and I'm happy to be here. Thank you.
Thank you, Dr. Parikh. And last but certainly not least, Dr. Carrie Rogers from the Ohio State University College of Medicine and Comprehensive Cancer Center. Dr. Rogers, would you like to introduce yourself?
Sure. I'm Carrie Rogers. I'm a hematologist at Ohio State, and I'm an associate professor at The Ohio State University. My clinical research interests include chronic lymphocytic leukemia and hairy cell leukemia. I have a special interest in autoimmune cytopenias.
Our topic for today is which combinations of novel therapies are you particularly interested in for the treatment of CLL in the frontline, relapsed, and refractory settings? And then regarding doublet versus triplet regimens, do we know if all three agents are needed or are two enough?
Currently in the United States, the only approved sort of fixed duration therapy in the frontline setting is with venetoclax and obinutuzumab. I do think that being able to sort of say I'm done with treatment is an important thing for many of our patients. However, we know that patients with del17P, those who have bulky lymphadenopathy, and those that have unmutated IgB8 genes, in multivariate analysis, these three factors were shown to be associated with a shorter progression-free survival in the CLL14 study. So there's, certainly a subset of patients where we will not expect to see a durable progression-free survival or durable duration of response from this therapy. And I think that's really where, at least for the last decade or so, there have been a lot of approaches to improve upon this with combinations consisting of a covalent BTK inhibitor and venetoclax. So I think, unless we have more data for the triplets, and their safety, we should not be using them in the clinic. Only in the context of a randomized trial, they should be used. And I think to answer your question about what I'm most excited about, I think it's really the doublets with covalent BTK inhibitors and a BCL2 inhibitor in the frontline setting.
It's not obvious to me that one regimen's better than the next, and I tend to want to go with a 2-drug regimen over a 3-drug regimen at this point until we know better. I think the combinations of covalent BTK inhibitor with the venetoclax or another BCL2 inhibitor are really quite exciting. The whole notion of having all oral regimen, I think, is appealing to patients by having a lead-in. You can often, with the BTK inhibitor, you can often reduce the risk of tumor lysis syndrome, making it easier to give that regimen.
Pointed something out that's really important, and that's like the duration of the drugs, especially with these covalent BTK inhibitor venetoclax regimens. You'll see either one or both of the drugs are continued for various durations based on detectable CLL without proof currently that that's necessary.
Okay. Thanks so much, Dr. Flynn, Dr. Parikh, and Dr. Rogers for sharing your expert insights with us on these important topics for the treatment of newly diagnosed chronic lymphocytic leukemia, relapsed and refractory chronic lymphocytic leukemia, double exposed and double refractory chronic lymphocytic leukemia, and accelerated chronic lymphocytic leukemia and Richter's transformation. And thanks to our audience for tuning in. We hope you found this podcast to be valuable for your practice, and we look forward to having you join us next time.